Hey, this is Brad Block, host of The Physician's Guide to Doctoring. This is a personal and professional development podcast for physicians where we have experts on the show that try to teach us everything we should have been learning while we were memorizing Krebs cycle.
Imagine this. Imagine that you're one of 30 million Americans and you're getting your care, and you're a medically disadvantaged American, and you're getting your care through what we call a safety net clinic. Now, these are staffed by primary care doctors, family physician doctors, PAs, nurse practitioners, and they're pretty well staffed with those people, but they do not have they have very minimal access to specialists like GI people or cardiologists or neurologists. So imagine yourself, you're a clinician and you're seeing one of your patients and they have a problem, a dermatology problem or a GI problem or whatever. And you want to get some help on this patient, and it is going to take you you know that if the backup is challenged, that you're going to have to wait 3 to 4 months to get your patient seen. Imagine yourself that you're a patient and you've seen this PA or you've seen your family doctor and he doesn't exactly know what's going on and he tells you it's going to be 3 months before you can see a specialist. Imagine yourself in that situation. Today, we are really privileged to have Dr. Laurie Green here because she has made an attempt to solve that problem. And now, if you're working as a clinician in one of these specialty clinics, you have a way, you have access to getting specialty consultations for one of these patients within hours. They don't have to wait 3 to 4 months and all the anxiety. So, Dr. Laurie Green, welcome. You have envisioned and you are the founder of what we call MAVENProject.org. Dr. Laurie Green, what is MAVEN Project? Tell us what this is.
Good morning, and thank you for having me. So MAVEN actually stands for Medical Alumni Volunteer Expert Network. And of course, the word MAVEN means to share knowledge. It all started back in 2014 when a group of medical school alumni leaders were looking for capstone projects for our alumni councils and our alumni associations. We were thinking about what could we do for a fellow alumni. And at that moment, the Affordable Care Act was about to be implemented. And most alumni councils for medical schools have a diverse group of counselors. Some are clinicians, some are researchers, and they span every field you can imagine. And we all came together and said, we recognize that with the Affordable Care Act, individuals across the nation would suddenly be insured when they had not been up until that point. Yet having insurance did not confer access. And as Dr. Abramson said, there are 30 million people who may be insured. They may have Medicaid. They may have a health plan that from one of the state exchanges that has such a high deductible that they cannot afford to even pay their portion of their healthcare bills. And so we recognized there were a group of individuals of our alumni. We called it the Silver Tsunami because there were quite a few alumni who were about to retire, but still wanted to participate, still wanted to give back. And then there was the need. And the third component that was so important was technology. And I have to say, back in 2013, 2014, telehealth was a nascent industry. Many people felt telehealth would fail. And we recognized that we could be Match.com meets the Peace Corps. We could link these volunteers with the clinicians that Dr. Abramson describes, many of them, and these clinics, safety net clinic there are 2,800 of them in the country. They're scattered throughout the nation. There are rural, they are, core urban locations. But the characteristic is that they are extremely culturally competent and they serve populations, immigrant populations, the working poor. And they are the primary site for care for this 30 million population, 80% of whom actually work. And we recognize that the clinicians in these clinics were, many of them, freshly minted doctors. They were nurse practitioners and physician assistants who get 5% the clinical training that a physician gets before they're literally released into the wild. And so we recognize that technology could connect our volunteers to these clinicians in a way that isn't just an exchange of medical information, because there are companies that do that, but really in a relationship. So the MAVEN Project recruits specialists, although we also have primary care providers. And we not only just exchange medical information, but we mentor and we educate at the level of the clinician. And then, of course, we give the medical advice to the primary care providers taking care of the most medically disadvantaged, underserved individuals in this country. And that was the point, to bring together technology, volunteerism, and need.
Wow. And I can tell you this, and full disclosure, I've been a volunteer for MAVEN as volunteer neurologist for the last 5 years, and it has been so rewarding. And I'm going to have to all put in my 2 cents about what this has meant for me and other volunteers too. You talked about the relationship between the clinicians there and the volunteers. Can you speak more about that, the relationship that's developed?
Sure, absolutely. Well, I think all of us who practice medicine know we're like the opposite of law. The most respected lawyer expert in a field has to do case law research before writing an opinion. And in medicine, there's this sense that you should know it all. And when you put clinicians in a setting where everyone is running wild, everyone has a crammed schedule, it's not like you can pull on the shirt sleeve of the most senior doctor in your clinic and ask for advice. So between the sense that we should know all of this and the fact that you don't necessarily have people around, the day of the curbside consult with all of the stresses and volume that everyone needs to see, those days have passed. And then if anybody in the audience has tried to use up to date, I'm sure you realize that you just want to bang your head into the wall, because you can't get a simple answer out of up to date, even on the most simple questions.
Yeah.
So the relationship part of what we do has to do with the fact that the clinicians, especially the clinicians in these settings, really don't, they're having to learn the art of medicine.
Yeah.
And they also have limited education on the science. And so how do you make sure that a clinician understands that not only are you accessible, but that no question is too small? The idea that there is a safe place where you can get the information you need. And not only that, but you can get it in an efficient, pragmatic, clinically oriented way. I mean, all of us have sat in the classroom, and there's a point at which the mechanism of action of a given medication isn't as important as walking away knowing what the drug interactions will be or how you can get into trouble. And so much medical education is weighted down. Part of it is the people who teach, right? Because academicians see a bigger picture, and often they have a niche where they can get into great detail. But when you have to get through 30 patients in a day, and frankly, I'm an OBGYN, but I do a lot of primary care. And I see 30 to 35 patients a day. So there's this feeling you have that you really need to get an answer, and you want to get it quickly, and you want to get it in an actionable form. And so the relationship component really is that the volunteer is someone the clinician knows. It isn't some faceless person eating a sandwich and writing a consultation at their lunch hour. And the education in particular. And Dr. Abramson has been very involved in not just some of the lectures that give you the basics of EKGs or rheumatology or what test to order, but also, there was a wonderful lecture, Don't Get Furious, Get Curious, how to deal with a difficult patient. We have several, tips of how you get through the day. So I think this is what makes MAVEN unique. I'm sure anyone who's ever gotten a consult out of their field, you get these consultations and there are all these abbreviations you don't know. And it's
Yeah.
like, oh my God, I'm looking up on Google.
Yeah.
What's it mean? I want to know. I look at things like some of the transesophageal echoes. It's so frustrating. And the
Yeah.
MAVEN Project erases all of that. Can
Yeah.
you imagine? We all, when in this era, which is so different from what it was 40 years ago when I first started, in this era, you've got to cut to the chase and you have to be able to ask questions. And I
Yeah.
think that the ideal environment for that to happen in a successful way is the way we've structured the MAVEN Project.
Yeah, it certainly is. And let me just reemphasize some of the things you said, because I've been like on the front lines on doing these things. And as a volunteer, we're tired old people and we got a lot of time on our hands. So when we get one of these consults, it comes by an e-consult, and we can really have a thoughtful response. And we have, 30, 40 years of wisdom to give to these people. And so it's not just something we're just, writing off in 30 seconds, like a lot of times what you would do if you were in practice, but we can be thoughtful and we can be empathetic, knowing what these people are up against. The other way, as you mentioned, Laurie, that the way that we help these people is that we also provide lectures. Is that we, on basically in topics of our expertise, we will develop lectures and give these to and open these up to all these clinics. And I was just looking on the MAVEN website today, and so I just found this. So for this week, here are the lectures that we are offering. By the way, how many clinics does MAVEN have as connected to them?
We're in 25 states and DC. We have nearly 400 clinic sites.
Wow. And a lot of these are in urban and core areas, inner cities, Appalachia, things like that. 400 clinics. And so each one of these clinics, all the clinicians have access to us. So I looked on the MAVEN website. And so for this week, here are the lectures that we're offering to these people. August 13th, assessment of abnormal liver test. Another one on August 13th, later on the day, is EKG mini-series number 2, ischemia and other ST abnormalities. August the 14th, hypertension update. August number 14th, later on in the day, chest pain in children. And on August 16th, evidence-based management of acne. So this is a typical week where not only are we offering specific consults, but we're offering these lectures that we do. And in addition, and I think you touched on this, the other thing that we offer is mentoring. And so we offer one-to-one mentoring on these people, these clinicians that are working in these underserved clinics, and they may be having trouble with work-life balance, maybe dealing with leadership, maybe with how to become a leader. And we have a whole group of mentors that offer ourselves to work with these folks. And and I think that we really, in that way, we also offer a lot to these clinicians.
Absolutely. No, I really appreciate you bringing that up. And in fact, the lectures are on our YouTube channel. I was looking at Dr. Schulman, who's an emeritus Harvard Medical School cardiologist, just gave a wonderful one, plug, about hypertension. And the
Yeah.
slides are fantastic. He starts out with the story of FDR, and that was remarkable. The blood pressure he had and the GI bleed he had. I mean, words, not only are these lectures to the point with actionable information, but they're engaging and they're amusing. And, they're the kind of lectures that you leave, with the information in your head. In other words, it's education that sticks.
Yeah.
And I wish I had time to listen to every MAVEN lecture. The slides, by the way, for people who are interested, are quite good. And you can basically follow the lecture through the slides, but they are terrific. I really think we could have a whole medical school for clinicians, especially for advanced practice clinicians, based on the dossier of lectures we have as it is. And again, it covers a wide range of topics, including how to get through your day, but also virtually every specialty you can imagine. So we do have the lecture list, and and every one of these lectures is tops. And I will say that the volunteers get fantastic ratings on every parameter, 4.85 out of 5 for the work that they're doing. So there's a great deal of satisfaction, I think, on both sides, because I think the generation of physicians, and which I'm a part, I got out of medical school in 76. And, we all had medicine as a core part of our identity. Sometimes it was our identity. And suddenly, and what really struck me and why I was motivated to start the MAVEN Project was that I had been away from my medical school for quite some time and went back on a listening tour. And people I venerated in medical school, many of the academicians who had taught me, were being unceremoniously shown the door. because their chair or their professorship needed to be given to a young individual where our institution was competing for that person. And so it struck me that some of these individuals were really kind of lost, kind of at sixes and sevens, thinking about what to do next. And I think the MAVEN Project has revitalized so many individuals. I've heard so much positive feedback because a lot of our volunteers, meet. Many are people who've retired from Kaiser, so they have a Kaiser organization they're part of as well. And we even had a group that wrote a book about humanity and art. And they came together and put together a book that you can actually get on Amazon, as you can get plug
Yep.
one book that Scott wrote called Bedside Manners. Humorous, warm, fantastic recollections. And it's what you compiled really that I think constitutes the wisdom of medicine. And the years it took to accumulate that wisdom is now being shared with people who are really at the dawn of their careers rather than the end. So there's a real generational pass through that I do not think happens in other clinical settings.
Yeah. And Laurie, I just want to say that what you mentioned is that not only is this of such value to the clinicians and the patients in these underserved clinics, but to us as volunteers. And you're right. We've had 30, 40 years of wisdom and we retire. And not only do we not feel useful, but we've lost our family, because our family was the people we have coffee with in the morning and talk about all this stuff. But this is what MAVEN has done, I think, for volunteers. And rekindle that feeling of being useful. So we're not only doing consults, we're doing mentoring, but as we prepare these lectures or as we prepare our consults, we have to keep up to date. I mean, we have to keep sharp and learn what's the latest. So that keeps us up to date. And, you talked about this family, about losing, the idea of, your colleagues and your family when you retire. And that is one of the great things for a volunteer. For instance, this afternoon, we have a group of volunteers that are interested in writing, narrative writing. So we have a narrative writing group and we're meeting this afternoon at 1:00. There'll be about 20 of us and we will sit down and we'll write stuff. We'll critique each other. And we've developed kind of a family around that. And as you said, we've taken some of the writings that we've done over the past couple of years and it's been published in a book. It's called Reflections on Medicine and Humanity. And you're right, it's on Amazon and all this stuff. So it's really a great feeling for us. It's so rewarding to feel useful again. It really is. And I want to just, I am so grateful for that, for those opportunities that MAVEN has afforded me and so many other volunteers. We also have, like a lot of us do, mentoring. So we have a mentoring group and we meet I think it's once every 2 months, but a group of us mentors will get together by Zoom and we will talk about what are the difficult issues that we had in the mentoring? What advice do we have in this situation? So I've got a whole new family and I'm so grateful to that and grateful to you.
Oh, well, thanks. I mean, after all you said, it's all about relationships and it's all about community. And I think all of us who's practiced medicine over these years have seen that the days when you had these very personal relationships with patients
Yeah.
have kind of fallen by the board. I mean, we talk about the eye patient, EYE, versus the eye patient, I dot, and more as eye contact has faded and systems have taken care of people instead of people taking care of people. I think it's something that those of us who knew how it was value more and more. And I think it's something that needs to come back into medicine. And insofar as we've said, are in the relationship business with these clinicians and among ourselves, I think it revitalizes everyone. And as soon to be Vice President Waltz maybe said, it brings back the joy.
Yeah,
So,
it really does. It really does bring the joy and meaning back into our lives that so many people that have retired. And you mentioned the gray tsunami, and I am part of that revitalized tsunami. I'm not very gray, but as you can see, but it's like, yeah. Laurie, I want to just ask you this. So this interview is taking place at 7:00 in the morning in California time. You're in where in California are you, by the way?
In San Francisco.
You're in San Francisco. Okay. You're in San Francisco. Now it's 7 o'clock in the morning here. We logged in at 6:45 just to make sure mechanically was going on. And it turns out, tell us what you did before you logged in at 6:45.
I'm still a full-time obstetrician gynecologist. So I did a C-section and rounded on 6 patients before I came over. But I do that every morning. But it's wonderful to be energized. I also am deeply committed, and I think everyone who's had a long career realizes that what gives you the greatest pleasure and fulfillment is feeling like you're helping the people who need it the most. And I have a practice of patients who are very well insured and will do all their diligence and do all their research and help stay healthy, and sometimes I think make many of their own healthcare decisions, and I'm just there to facilitate. But then when you think of the potential you have to help the individuals who really are the grease of our society, we're helping the gardeners and the babysitters and the farm workers whose insurance is poor, and the restaurant workers and the construction workers. There are so many people who are vital to our society running. And the idea that you can help them by working with their primary care providers is so fulfilling to me, sometimes more than just the face-to-face. I mean, and I have a high bar because I get to deliver babies every day, but I enjoy this the most. I feel most fulfilled and accomplished through what the MAVEN Project has been able to do. And then I happen to be the president of the Health Commission for the city and county of San Francisco. And once again, we have every imaginable element of public health we're responsible for, in addition to oversight at our large county hospital and one of the biggest skilled nursing facilities in the country. And that's really, that's the positive part. So as clinicians retire, and I think these opportunities are there, MAVEN Project is certainly there, but those give back opportunities are, I think, so fulfilling and gratifying. And that's why I love this. That's why I get up at 4:30 so I can make it.
I was going to ask you what time you get into work. So now I know 4:30 you get into work, and now you've got another patient. I think you scheduled about.
I got 31 in here today, but that's because
31 patients. Oh, okay. Oh my God. Okay. So, and let me just say this, just to emphasize this once more, because I have heard this so often. And when you're in one of these safety net clinics and you're a clinician there and you're kind of inexperienced, if somebody has a problem, it may be a relatively simple problem, but you don't know who to turn to because your consultant is going to be 3 months down the road. And I can tell you, this is an absolute fact. It happens over and over again. And with a click of the mouse, you can get in touch with a specialist, 30, 40 years of experience, and get their advice and their wisdom. And most of those times, they don't even require that consult. They won't even need that consult, that we'll be able to handle that patient right away. And if you've had that happen to you 3 or 4 times a day, and you're just left in limbo, God, and you feel terrible for your patient, I mean, that has got to take a toll on physician resilience and physician well-being. And imagine just these farm workers and restaurant workers, the salt of the earth people, and they have to go home and wonder, oh my God, what does that skin lesion mean? Is the doctor said something about an EKG, and for 3 months you're going to wait. It's just extraordinary, I think, what this has done. So let me ask you this. So you are a full-time OBGYN doctor. You're getting up at 4:30 in the morning to do C-sections and see patients in the hospital. I'm not sure. What is your title? Yeah, of the MAVEN Project. You have, fostered this thing, guided it, and so forth. You are the president of the San Francisco Health Society. And I'm not even going to ask you what else is on your plate. How do you do it? How do you manage your own work-life balance? How come you're not frazzled and everything? How do you do this? Most people would have trouble doing one of those things.
Well, you love what you do. I always laugh. Once I was in this group and we had to say what character in fiction or film we most identified with. And I said the bus on the movie Speed, because if I go any slower than 85 miles an hour, I will implode.
Oh, man. And I understand that what you're doing gives you a lot of fulfillment, but what do you do to slow down the bus? I mean, for your own well-being.
I am of the generation that my identity is medicine. And I love it so much. I mean, in OBGYN, you get such joy all the time. I mean, you're with people at this moment of life that they'll never forget, and you get to be a part of it.
Yeah.
So, that just gives you energy. It
Yeah.
gives you strength. It gives you energy. I think all doctors have had this experience of think about you never have to wonder why you're getting up in the morning and what you're going to do and what your purpose is. And I think it's really energizing and a real
Yeah.
privilege to be able, it's that great thing. You make a living by what you get, you make a life by what you give. And we've had the privilege in medicine of being able to make lives.
And what you're saying is just so contrary to what you hear today from folks that I mean, because what I hear you saying is it's your passion. I mean, this is what gives you this is your calling to be a doctor. This is what gets you up in the morning. My God, I just can't wait to get in and deliver that baby and see the smile on that couple's face that had this baby. I mean, that is the passion that you have for doing it. That is your calling. It's not just a career. It's not just a job. And yet so many doctors doing the same, having the same responsibility, the same job as you get up and look at it as, oh my God, it's another day in the chocolate factory with Lucy and Ethel. And man, and I'm dealing with all the administration and all the EMRs and all this, and I'm burnt out and things.
Yeah, the burnout is really, I mean, for the younger generation, it's a great worry. Someone once told me this, how medicine has kind of devolved over time and how when we first started, we were physicians and our patients were patients. And now we're vendors and our patients are loss units. How can the vendors and the loss units try
Yeah.
to work together to make it a better experience for the providers as well as a better health situation for the patients? And what you brought up about access, I think is really important because at least here in San Francisco, it isn't just the underinsured that can't get specialty care. We actually have more volunteers in rheumatology in MAVEN than there are in the city of San Francisco. I used MAVEN, and I'll give you a really great example. So, as I said, in OBGYN, because I've known people for so long, I cross over the double yellow line of primary care more often than I should. I actually did a medical internship at Stanford. Maybe that's why. Who is dumb enough to do two internships? I did one in the old days, like 36 on, 12 off. So I did one in internal medicine and I did one in OBGYN. But at any rate, I had this 71-year-old patient I've known for years, and she had lost weight. She'd been to the emergency room with weakness in her extremities. She'd had the whole neurologic workup. Everything was negative, and we didn't know what was wrong. I reached out to a MAVEN hematologist because she had crazy lab work. Her ferritin was way elevated. Her C-reactive protein was through the roof. I
Yeah.
mean, there were all these numbers, and I'm not conversant in all of them. I didn't know what they meant. So I reached out to a MAVEN hematologist and a wonderful MAVEN rheumatologist who still attends at UC clinics, even though I think he's 90 or 91 now. He stopped biking over the Golden Gate Bridge when he was 87. But anyway, I reached out to them and I said, what should I do next? And I literally guided this woman through a whole rule out workup because she could not get into a hematologist. She could never get into a rheumatologist. And finally, and this went on over about 4-week period of time, I even sent her to the emergency room to get abdominal scanning because I was worried she had a malt lymphoma. And each thing ruled out. At the end of the day, the only thing she needed to do after I'd done these MAVEN consults was to get a temporal artery biopsy, which one of my colleagues in ophthalmology did. And sure enough, she has giant cell arteritis.
Wow.
And, she would still be suffering and still not have gotten in because I tried to pull strings to get her in sooner to a hematologist or a rheumatologist, and it was to no avail. So a very complex, CPC in the New England Journal case, which she really would have been,
Yeah.
ended up having a diagnosis and a treatment within 4 weeks. And this is what and a well-insured woman. And this is what the MAVEN volunteers do for patients who don't know where to turn and many times don't come to a clinic until they are extremely ill and then can only come once because of work obligations and childcare and
Right.
transportation barriers. We have a clinic that's a wonderful clinic here in San Francisco, Mission Neighborhood Health Center. They are walking distance from San Francisco General, which is where, they would go for inpatient care. But often you can't reach a specialist at the General in a timely way. At the General, we have what they call TNAA, time to next available appointment. And it's something that we work so hard. This is part of my health commission hat to try to decrease the time and increase the access. And it's almost impossible to do that. So MAVEN Project fills so many gaps. It is an opportunity for retirees and even physicians who have left clinical practice, maybe are in industry, that really want to be able to do something for patients. And it's a wonderful opportunity for us to stabilize the primary care workforce. And it's well known, based on, among other things, a blue ribbon panel led by Janet Napolitano and sponsored by the California Healthcare Foundation, about the crisis in the physician shortage and provider shortage that is looming. And they recognize that nurse practitioners and physician assistants will be the backbone of primary care, not just for the underserved, but for many other individuals as well. I'm sure many of you have experienced that, where the PA or NP is the individual who sees you. So drill down to the, less well-paid clinics. And you can imagine that it will be these individuals who are relatively undertrained, but are put into a clinical situation because of a great need and the dearth of clinicians. And here MAVEN Project is to make them be able to practice at the top of their license. So what do? We help people practice at the top of their license and at the top of their humanity.
Yeah. Wow. Yeah. It's said that so well, the top of their practice and top of their humanity. And that's really what's it about. And gosh, that's extraordinary. I mean, you're in this high practice clinic and you're having trouble getting people seen to be a specialist. You yourself called on a MAVEN volunteer, and you mentioned Dr. Schulman giving this talk on hypertension. That was a great talk. I listened to it, and I myself had a question on my own hypertension, and I emailed him and talked to him, and I got some great advice. So, that's another advantage. We volunteers, it's like a family. We have, like, how many volunteers are there, by the way? How many
We
do
have
we
about
have?
363 specialties. Obviously, we don't deploy them all, but
Yeah.
I have to put in a plug for Jill Einstein, who's from the
Yeah.
beginning has been the head of physician engagement, and she's an internist who stepped back when she had her family, and she's been absolutely wonderful in
Oh
bringing
my
us
gosh, she's
together. And
fantastic.
also, the other thing we shouldn't overlook, is an amazing infectious diseases physician named
Yeah.
Debbie Gold, who was retired from Kaiser. She gave the most remarkable lectures about COVID weekly with
Yes.
up to date data. She literally scoured the planet getting the latest research, the latest thinking. And just to give you a sense, not only did we have some donors who listened to her lectures every week and logged on, but she, at the height of the pandemic, she had nearly 100 people listening to her talks. And then she'd bring in some other infectious diseases individuals. Seattle has an incredible infectious disease division, always has. And one
Mm.
of the physicians who had been a professor there came along, and they would have some panels. But I think, she got many clinics through one of the most trying times in
Yes.
medicine that's happened in our lifetimes. And
Yeah.
so, this is the caliber and the commitment and the effort that our volunteers put forth.
Yeah, she's fantastic. And so, Lauren, let me ask you, you mentioned about donors, about our volunteers. What would you like people that are listening in to hear, that listening into this podcast, that maybe they're near retirement or maybe not in retirement? What can they do to help this project along?
Well, thank you. That's a great question. We need funding, and I
Mhm.
think donors are very important to us. We are mostly funded by philanthropy. In fact, some of the clinics that are themselves decently funded, some of the federally qualified health centers, pay a nominal fee. And then it's complete access. So unlike these commercial organizations that provide consultations where it's a per encounter fee. It is basically as much as you need, as often as you need, with all our services available. And for free and charitable clinics, it's free of charge. So, in order to develop the platform, improve our platform, which is really our heartbeat, it's our way of communicating, to be able to, we pay for malpractice, and we obviously do background checks and make sure all our volunteers are up to date. All of that takes manpower and it takes funding. So the smallest amount really means a lot to us. It's fascinating with grants because we've discovered, although we are in the midst of hopefully having some data to improve our grant opportunities, there are many grantors that want to study what to do about healthcare access and healthcare for the underserved. And we have a solution.
Yeah.
And so it's frustrating because, they fund thinking, not they fund I think it's who makes the decisions, right? They fund the world of ideas, and we are the product. So as far as we can get funding, that's fantastic. We love volunteers, and especially people with expertise who want to serve. And we have primary care providers who actually only do mentoring. In other words, if people are afraid that they may not be the most up to date in their specialty, you'd be surprised at just the tools you can give primary care providers through just the art of medicine and the wisdom we've all accumulated through the years of caring for patients and practicing medicine. And so those are two things that come to mind. And all, the volunteer option, as well as, of course, the donation, are all on our website.
All right. And the website is, what's the website?
www.mavenproject.org.
Okay, folks, check it out. Because as you so eloquently say, Laurie, people are having commissions. They're talking about, they have ideas, they're throwing around it. But MAVEN Project is not just talking the talk, we're walking the walk. We are already giving so much benefit to so many people. I know that you have to get back and deliver some more babies and do all this and that. So we'll close. And I just want to thank you for, your vision in founding this organization, for your inspiration and for your leadership in it. It's made such a difference to to 30 million American patients who are in these underserved clinics, who are now able to get advice and help on their problem without waiting 3 to 4 months. That maybe something could have gone wrong in that month. Maybe they're just living with the anxiety and you've given so much comfort and help to these clinicians that are struggling in these underserved clinics. And now they're able to help their patients, not having to sit on them for 3 to 4 months, and able to help them right so much. And also you've given so much to folks like me, retired folks who now feeling useful and feeling that we're recovering after retirement, that we've lost so much, that we're recovering the joy and the meaning of what we did and the passion, as you've mentioned yourselves. And I want to just thank you so much on behalf of the clinicians, the patients, and the volunteers who work with MAVEN Project. Thank you, Dr. Laurie Green.
Thank you so much. It's a real privilege.
Thanks for listening. So please share it, or like it, or comment on a social media post, or write us a 5-star review. Thank us again for listening to The Physician's Guide to Doctoring.